same time. Uh, and our presenter will be Rabbi Lynn Louie, I believe is still, if that's correct, but I'm seeing Ben nodding, so we're good on that. So we look forward to seeing you all there as well. Today, we are very lucky to have Dr. Steve Cunningham present with us and share with us today. Dr. Cunningham is the Director of Pancreatic and Hematology Surgery and Director of Research at Ascension St. Agnes Hospital in Baltimore, Maryland. He attended medical school at the George Washington University and completed his residency at the University of Maryland and a fellowship at Johns Hopkins. He is currently completing his master's degree in religion at Harvard. He has served as the contributing editor to the Maryland Poetry Review and has had his poems published in that journal, as well as Wordhouse Baltimore's literary calendar and the anthologies Function at the Junction #2, Pasta Poetics, and Poems for Chromosomes. He has also published 3 books of poetry for children, which he calls his Poemenclature series, designed to teach concepts and ideas through poetry. They include Dinosaur Name Poems, Your Body Sick and Well, How Do You Know? And it's considered to be literate about religion, which is his newest book. His books have won numerous awards, including multiple Moonbeam Awards and the Colorado Independent Publishers Association Evie Award. He has an active interest in spiritual care research and healthcare, and I had the pleasure of going through the Transforming Chaplaincy Researchers 101 with him, 2 years ago, I think?
Yes, I think so.
And so Dr. Cunningham will be speaking to us about religious literacy today. So thank you so much, and a very warm welcome to you.
Thank you so much, Brandon and Ben and everyone for being here. It's really an honor and a pleasure to join you again this month and to be presenting here at this really wonderful forum. So I'd like to talk today about the spiritual care of patients and also, of course, of each other, a discussion of religious literacy in healthcare. I don't have any financial disclosures. I will mention a book that I wrote, which Brand just mentioned, but the proceeds of that book are being donated to charity. Just a quick outline of what I'd like to cover today. First, I'll give just a brief overview, and then I'd like to discuss religion and religious literacy, and then segue into spirituality, and we'll take a minute to talk about how those are different. And then I'd like to talk about some of my current and future research directions about spirituality and religious literacy as applied to the healthcare setting. And finally, I'd like to leave you with just a couple of resources. So regarding overview, most people in this group are very well acquainted with this paper by Tracy Balboni. Probably some people in this group better acquainted with it than I am, but it came out just a few months ago. If you're not acquainted with it, it's one I would certainly recommend knowing about, although this group, of course, already appreciates its implications. I do like to stress its importance to some of my other colleagues, other clinician colleagues who may not fully appreciate the importance of spiritual care for our patients. Indeed, this paper is thought by me and by several experts in the field to be one of the most important papers in the last 20 years or so on the intersection of healthcare and religion and spirituality. It is, of course, published in a major medical journal, JAMA, the Journal of the American Medical Association. And as you know, it reviews evidence in a quite rigorous way that we clinicians must proactively incorporate spiritual care in our practice. It's care which is person-centered and value-sensitive. Because we know that while patients want and need spiritual care to be a part of their care plan, we clinicians, maybe especially we surgeons, are not by and large comfortable enough with our religious literacy to do this. So to help remedy this situation, I've been doing 2 main things. One is planning this study, which I'll talk about a little bit later. I'm calling it the MedRelit study, or Measuring Religious Literacy Among Healthcare Providers. It is as part of my master's thesis at Harvard, looking at religious literacy among healthcare providers, particularly surgeons and oncologists, because they're the ones who often care for patients at a time of crisis, such as the need for an operation, a new diagnosis of cancer. And the other thing that I'm doing is this book of mine that Brandon mentioned, which was released in November, and which is related to my research plan. Insofar as both of these arose from courseworks done during my master's. The book itself is a collection of nonfiction poetry and prose. It's for all ages. It indeed does. It looks like and indeed is a kid's book, but it's in some ways a book for adults disguised as a kid's book. It's about religious literacy and about religion, peace, and conflict in our world. And it's set up with poem prose pairs, with each poem followed by a learn more section. Both the book and the study raise the question of what religious literacy is and what even is religion. And so moving on to that topic, so these are some important questions that I think we should ask here. What is this thing called religion anyway? What do I mean by religious literacy? Because there are different conceptions of religious literacy, and we'll come back to that. And how can you be more religiously literate? These last two are kind of the same question, because the degree to which we understand what we mean by religious literacy correlates, of course, with how much we can be intentional in our daily lives about being more religiously literate. So what is this thing called religion anyway? Sometimes it seems like it's the scripture that really defines a particular religion. It may seem like the rites, rituals, and ceremonies of a particular religion are what really sort of define a religion. Or maybe it's just the beliefs of a particular faith community. Or maybe it just depends on the individual. Well, it is, of course, no single one of these, but yet all of these. In my book, one of the very first poems is called What is Religion? In fact, part one of the book describes and illustrates religious literacy as defined by the American Academy of Religion. While part two uses that lens of religious literacy to examine several conflicts around the world that have revolved around religion, such as in Syria, Myanmar, Nigeria, Israel, Palestine. And part three is sort of a summary putting it all together. There's also a glossary and a reading group guide. Just to give you an idea what the book looks like, this is one of the poems. This is the What is Religion poem. And then this particular poem has a 2-page spread. I'm not going to take time to read this now, although we certainly can come back to it if we have time later. If anyone would like, I'd be, of course, happy to do so. And I will, the end of that learn more section does sort of give my definition of religion. I'll come back to that in just a second. So what is religious literacy? I'm going to give just 5 tenets of religious literacy here that pretty much encapsulate the American Academy of Religion's definition of religious literacy, which they and I and many people think is sort of mandatory, learning for elementary, secondary, undergrad, and undergraduate, and indeed all adult education. Sort of be a good citizen. And I'll list them first, and then we'll come back and talk about each one. So the first one is distinguishing the inside versus the outside. The second one is recognizing that religions are internally diverse and dynamic. 3 is understanding that religions lack agency. 4 is appreciating religious influences. And 5 is recognizing our perspective or our situatedness. So what do I mean by distinguishing the inside versus the outside? Well, by the inside, I'm referring to a prescriptive, devotional, confessional, theological engagement with religion. This is what perhaps several people in this call do on Sundays or Fridays or Saturdays or any day of the week. It's engaging with religion from the inside, practicing that religion. By contrast, from the outside, I mean a descriptive approach, an analytical or cultural studies approach to religion, which is an entirely different way to engage with religion. And I think the difference here is highlighted nicely by these 2 groups. The Westboro Baptist Church, which, as many of you may know, is a hate group from Topeka, Kansas. They're the ones you may have seen over the years on the news holding up signs on the corner saying God hates fags, or other similar signs. And of course, ISIS, Islamic terrorist organization. We find ourselves often asking with groups like this: is the Westboro Baptist Church practicing true Christianity? Is ISIS or Al Qaeda practicing true Islam? And while these are really important questions to ask, the point here is that these questions are asked from within a faith tradition, because if you think you're asking those questions from within in an objective sort of way, then it becomes very easy to write them off, because the answer, I dare say, for many Christians or many Muslims is no. That's not the best interpretation, or that's not quote unquote true Islam. But if you mix up the inside versus the outside, then you find yourself just writing these groups off, and doing so is dangerous, I would suggest, because it then prevents us from taking the next step and asking really important questions, like, what is it about ISIS that attracts so many recruits? Or what is it about the Westboro Baptist Church that allows them to still exist today and hold up those signs? Another problem with this is encapsulated in what Chimamanda Ngozi Adichie has called the single story. If you haven't read her book or seen at least her TED Talk, I would highly recommend it. It's very easy to find on a Google search by putting in simply the single story and her name. But we can very easily find ourselves reducing groups whom we other to a single story. And the danger of doing that is that the single story is incomplete. It emphasizes how we're different rather than how we're similar, and it makes it easy for cultural violence to occur. Cultural violence is, of course, that kind of violence that underlies the structural, or sometimes called systemic, violence that we hear about so much and unfortunately see so much in society, which of course underlies direct violence. And this terminology is borrowed from Johan Galtung, who he's thought by many to be the father of peace studies. He's the one who coined the term cultural and structural violence. And this is a theme, by the way, that it's a thread that runs through the book. Cultural and structural and direct peace and violence. The second point is a little easier to get your head around. It's simply recognizing that religions are internally diverse and dynamic. In other words, not all Christians, Muslims, Hindus, and agnostics are the same as all other people in those faith traditions. It sounds kind of obvious to say it, but it's something that's super easy for us to forget. I certainly have forgotten it. There are actually multiple legitimate interpretations, and this doesn't mean that anything means anything. But indeed, there is not a single one right interpretation of any particular faith tradition. Because after all, religions are internally and temporally diverse. In other words, they're internally diverse, and they're dynamic over time. They change over time. Christianity or Islam or any other faith tradition is a religion of peace, is something that one might be inclined to say, but is actually kind of a little bit religiously illiterate to say, because it implies that there's a homogeneity that just doesn't exist. Number three is understanding that religions lack agency. We saw this kind of religious illiteracy or literacy sometimes, unfortunately a lot of illiteracy, around the time of the 2016 election and other times after 9/11, when the term Islam hates us was uttered. Religions don't hate or love anybody. They don't, in fact, do anything. In other words, they don't have agency like people do. People, not religions, are actors with agency. We have the ability to do things in the world. Religions are not like that, although it's easy to ascribe agency to them by saying something like Islam hates us, or look what Christianity did. But it sets us up for a lot of confusion when we start doing that. So people, not religions, are actors with agency. And what we do, in fact, matters. And continuing that theme, or that thread that runs through the book about peace and violence, what we do matters, because neither peace nor violence is inevitable in our world. It depends on what we humans do. Number 4 is appreciating religious influences, because they exist in all or nearly all aspects of our public and private life. Indeed, one of the things that probably struck me most during my master's in religion that I just didn't sort of recognize before is just how deeply embedded religion is, throughout our public life and culture, and how subtle this is. It's a little bit like the fish, the water the fish swim in. It's easy not to see when you're around it all the time. Religions are certainly private affairs, but the point here is they're not merely private. And then finally, number 5, recognizing our perspective or our situatedness. It is, for most of us, certainly for me, very easy to forget that the only place from which we can see, experience, and understand our world and its religions is, you guessed it, precisely where we happen to be. In other words, we cannot pull off what Donna Haraway has called the God trick, which is a trick in which we can see everything from nowhere. And of course, we can't do that because we are all, after all, somewhere. So those are 5 tenets of religious literacy that are outlined by the American Academy of Religion, and which I have tried in the most accessible, perspicuous way possible in the book to show and illustrate with the poems and the learn more sections. Moving on to spirituality, what is the difference between religion and spirituality? Well, they're certainly related but distinct concepts. Religion, I would say, it's a construct that's made by people. It occurs in the context of a culture and a society. It is generally institutionalized in a set of beliefs about the transcendent, which is generally shared by a community, often including worship of God or gods, and typically stressing a distinction between the sacred and the commonplace. Spirituality, by contrast, is a broader but related concept. It is traditionally and historically rooted in religion. Spirituality is a dynamic, and I think this part is essential. It's an intrinsic part of our humanity, through which we seek ultimate meaning, purpose, and transcendence, and we experience a relationship to self, to family, to others, to our community, to society, to nature, and the significant or the sacred. Spirituality is often expressed through our beliefs, values, traditions, and practices, whether those be religious or not. So there are, of course, many reasons why we care about spirituality and the health of our patients. One of which is that it is one of the main domains that make up the whole person. I don't know, 100 or 200 years ago, I think physicians were all about the biologic patient. In the 1940s or so, the WHO redefined health to be not merely the absence of disease, but to include the biopsychosocial person. And in more recent decades, we're now really realizing that the spiritual component is just as important as those other 3 components in making up the whole person. And the spiritual part, of course, includes things like meaning, purpose, dignity, hope, faith, and community, connection and love, forgiveness, and gratitude. Another reason we care about this is that an increasing body of research shows that spirituality and religion are associated with improved health, improved quality of life, decreased depression and anxiety, better well-being, improved coping, improved social functioning, and greater ease of decision-making, and more satisfaction with the decisions that we do make about our treatment and care. Spiritual distress, by contrast, is associated with more pain, depression, anxiety, poor emotional well-being, diminished quality of life, less satisfaction, and even increased risk of suicide. Spiritual distress occurs when patients experience but yet cannot resolve a loss of dignity, or meaningless, hopelessness or despair, feeling loss of control, or when there's a conflict between deeply held beliefs and values and actual life events that are happening, such as an illness or a loss of a loved one to an illness. These are one set of criteria for diagnosing spiritual distress. This is from Dr. Polchowski and Dr. Farrell, two world leaders in the area of spiritual care. A spiritual issue becomes an actual diagnosis if it leads to distress or suffering. If the spiritual issue is the cause of a psychological or physical diagnosis, or if the spiritual issue is either a secondary cause or affects the presenting diagnosis. And there are, of course, three ways to sort of three levels of inquiry for this. Again, I say all this fully recognizing there are people on this webinar who know more about this than I do. The most superficial level, which I'm trying to get a lot of my surgical and other medical colleagues to embrace, is just a mere spiritual screening. It's the briefest type of inquiry, and it can and should be done by any clinical provider, any nurse, any person even doing a general screening. The next level of inquiry would be a spiritual history taking. This is a little bit longer, but not very much longer, and typically is done by a clinical medical care provider, such as a physician, a nurse, or a PA. And then, of course, you have the final and the level on this slide, the most extensive level of inquiry, which is a spiritual assessment. This is typically done by board certified chaplains, spiritual care providers, mental health professionals. And it's one of our goals here locally at our ministry at Ascension St. Agnes is to try to get more people engaged on the spiritual screening level, because it really is easy to do, especially the more you become comfortable with your own religious literacy and recognize that religion isn't something that you're just not supposed to talk about at Thanksgiving or with your patients. A big part of this is, of course, compassionate presence. These involve skills in which a clinician doesn't just have empathy, doesn't just listen, but moves to a more reflective and contemplative space with the patient. I like to think of this as compassion being spirituality in action. It's super easy, as most of you know, to do a quick spiritual screening. There are even one question assessments. Are you at peace is a single item, is such a single item assessment tool that's been well validated. It's actually one that I use in the office. You can actually just outright ask, do you have spiritual pain? Pain such as you might feel deep in your soul. And, if you have a patient, as I unfortunately do every so often, who is dealing with a new diagnosis of cancer or a prospect for a major operation, it's actually not that uncommon that they're feeling some spiritual distress, and armed with the tools of a simple screening, appropriate referrals can then be made to from a spiritual generalist like me to a spiritual specialist like many of you in this call. Here are some common spiritual history tools. There's FICA, the Spirit, and the Hope tool. The FICA tool is the one that I generally use. Certainly a very well-known one, designed by, again, by Christina Polchowski. The F is for faith, but doesn't necessarily need to be faith. It could just be the meaning that you ascribe to something in your life. Like the question might be, do you consider yourself to be faithful or spiritual or religious? Or it might just be, what gives your life meaning? The I, of course, refers to importance or influence, and here you want to know what importance does that spirituality or meaning have for your life? A super important question for I think all patients facing a major diagnosis is, what is your support community? What are you part of a community that shares these levels of meaning or spirituality with you? And then finally, the A is, of course, what would you like me to do? What action can I do in your care? How can we address this for you? And the answer to that question might be nothing, thank you, and that's okay. So just to wrap up this part about spiritual care and spirituality, some recommendations that I am sharing with my colleagues here. Every patient should be screened for spiritual distress. Extremely favorable cost-benefit ratio in doing this. Clinicians should be incorporating a spiritual history as part of their routine history. And they should be using an appropriate spiritual screening, history, or assessment tools, such as the simple question, are you at peace? Of course, there's recommendation about documentation. And last and not least, chaplains and other similar providers should be incorporated. Other spiritual specialists should be incorporated as an integral part of the healthcare team, and be recognized as the experts in spiritual care. So moving on to some, with that background, some current and future research directions. The study I mentioned before, I'm calling the Measuring Religious Literacy Among Healthcare Providers. In other words, the MedRelit instrument. As I mentioned on this overview slide, we clinicians, like a lot of the US population, sort of ironic point actually, the US is one of the most diverse, religiously diverse countries, and very religious compared to other Western countries, but yet one of the most religiously illiterate countries. And so I think there's a big need here. But anyway, we clinicians, like the rest of our US population, generally lack the religious literacy to be comfortable addressing this unmet need that patients have. And why is that? Well, there are several known barriers, most of which perhaps are not surprising. This was a survey of 339 oncology clinicians, and which found that most nurses and doctors do desire to provide spiritual care when caring for patients with serious disease, but cite lack of time and lack of privacy as common barriers, and then also cite, the majority of them, a lack of adequate training and the thought that spiritual care might be better offered by others. I'll do this, I'll do this, the chaplain will do that. I think those two really go together, because thinking that it's not your wheelhouse to even mention spirituality, it is a manifestation of inadequate training. So I think the inadequate training and thinking that spiritual care is better offered by others really go together. When you look more into the literature, I think it becomes clear that one common reason for these barriers is really the lack of comfort with religious literacy. When residents were surveyed, they widely thought that they should be discussing religion and spirituality, but said that they simply lacked the training and that this was an obstacle for them. Dinham, another world expert in religious literacy from the UK, has observed that the relationship between religion, spirituality, and healthcare has been largely poorly addressed, and because professionals generally lack religious literacy and therefore are largely unable to engage well with it in their workplaces. And finally, Shen and Steek have observed that the belief among healthcare providers that they need more religious literacy training is indeed quite common. But there's a problem here. This is a difficult area to study. One of the most fundamental unresolved issues in this area, I think, however important it may be for patients at the intersection of medicine and religion, it is difficult to study religious literacy because there's really no widely available tool to measure religious literacy. Unlike religiosity or spirituality, for which there are countless tools. I think I tried to count them once in preparation for my thesis proposal, and there are indeed a great many. Common ones you all may be familiar with, like the Durrell tool from Duke. Ken Pargament made RCOPE, which focuses on religion coping. And there are many well-designed, validated instruments that are used in the literature, but there really isn't one for religious literacy, nor even is there a universally agreed upon definition of what religious literacy is. And that's probably the rub, that those two facts might be related. Because this definition of religious literacy that I've shared with you and that I've tried to describe and illustrate in the book from the American Academy of Religion is one conception of religious literacy, but it's not the only one. It is a concept-based one that focuses on understanding what religion is, how it exists in our world. That religions don't lack agency, that they lack agency, that it's deeply embedded. You may have noticed as I was describing that kind of religious literacy that I didn't mention any or a lot of facts about religion. But there are other notions of religious literacy that are more fact-based or knowledge-based. One good example of this, I think, is Stephen Prothero's book, which was a bestseller, I believe, for some time, called Religious Literacy: What Every American Needs to Know and Doesn't. And he makes a really good point there. He says in that book that the U.S. largely is a country run by white, male, straight Protestants. And so if you want to be a good citizen in that in that arena, you ought to know something about Protestantism. But my feeling is that knowledge only gets you so far, and you can't possibly know everything about every religion. And if, like me, you work in a diverse healthcare setting, you're going to see a lot of people who aren't Protestants. And so if you're an expert in Protestantism, you will indeed get a lot of references and political speeches that you wouldn't have otherwise gotten, and you will be able to interact with your Protestant-dominated democracy, but you may not be able to interact very well with your non-Protestant patients or clients if you don't have a good religious literacy. So some of the current and in progress research goals that I'm trying to do to shore up this and this movement and to fill that need. One is a critical analysis using the literature of different conceptions of religious literacy as applied to healthcare. Two such conceptions, probably the two most common I've just described to you, more of a understanding-based conception and more of a knowledge-based conception, but there are others, some with more focus on actual theology. And Denham has a great book that goes into those. Another thing I want to do is to design and validate that missing quantitative instrument to measure religious literacy. I initially thought I might do this as my thesis project until I realized that this is a really big job, and indeed is illustrated here. This is a primer on how to do that. And again, by that, I mean to design and validate a novel quantitative instrument. It is a long 3-phase, 9-step process illustrated here. There's item development, which is one phase during which you identify domain items, and then content validity. In the second phase, which is scale development, you test the questions, you do a sampling of survey administration, and then reduce the number of items, and finally extract factors. And in the final scale evaluation phase, the last 3 of those 9 steps are tests of dimensionality, reliability, and validity. And this is a big job that requires a heavy dose of statistics. A lot of people, typically in IRB, for the testing of the questions. But this is what I would like to do, because I think this piece is missing from our current literature about the intersection of religion, spirituality with healthcare. So that's a second point. Another, the next step that I would like to do with that in hand is to use the instrument to measure the religious literacy of providers. Again, typically probably providers who are in oncology or surgery, I think would be a sort of ideal candidates, as I mentioned before. And then, of course, after the initial measurement, it would make sense to provide a short-term intervention to increase the religious literacy of that cohort. This could be done, for example, in small group sessions or in short in-service discussions. And then, of course, reassess the provider's religious literacy with the same tool, anticipating and hoping to see a difference. And then probably most importantly is to assess the downstream effects on patient experiences and outcomes. So that's sort of an outline of my research directions, what I've been up to, and where I would like to go with it. I do want to save some time for questions, so I'm going to just finish by sharing a couple of resources, many of which you may already know about. One is the GWISH ISPEC course. So GWISH is the George Washington Institute for Spirituality and Health, and ISPEC stands for Interprofessional Spiritual Care Education Curriculum. It's a 2-day, all-day, full-time course, typically in person, although this last round was virtual. I actually attended the course in November with a chaplain colleague of mine from Ascension, Tennessee. And the course is indeed designed for clinician chaplain pairs, and it's a teach the teachers to teach sort of deal where we then leave the course, go back to our respective institutions, and teach our colleagues sort of the basics of appreciating the role of spiritual care in their everyday practice, including screening for spiritual distress, recognizing spiritual distress, doing a spiritual assessment. The second resource I also think is very valuable. It's from Brandeis University and Chaplaincy Innovation Lab. So Chaplaincy Innovation Lab is part of Brandeis University, and they offer a very similar course, a spiritual generalist course, again, for clinicians. All clinicians, just to reiterate, should be spiritual generalists. Unlike the wonderful GWISH ISPEC course, they're both great courses, but one key difference is that the Chaplaincy Innovation Labs course is asynchronous. So might be a little bit easier for a cohort of nurses or other providers in your hospital, for example, to attend, since it doesn't require, dedicated 2 days. And then, of course, I would recommend my book on religious literacy, which Dr. Pulchowski very generously called a must-read for all clinicians and educators. And again, in it, I've really tried to present in one of the most accessible ways that I could manage for people of all ages, this idea of religious literacy. And so I didn't want to take too long, because I do want to leave some time for questions. So I thought, Brandon, maybe we just stop here and see if there are questions, or maybe we could just have sort of an open discussion at this point.
Absolutely, yeah. If you have questions, feel free to either put them in the chat, raise your hand, or go ahead and lift them up. I think one question that I had for you, Dr. Cunningham, as I was listening, is I can tell that a lot of this has come as you have developed in your profession as a clinician and as a surgeon. And I was wondering if you could share kind of what religious literacy or spirituality training was like when you were going through medical training in the beginning of your career that has kind of prompted you to say we need to do this a little bit differently.
Yeah, that's a great question, Brandon. Thanks. So I went to med school actually at GW, but that was quite a long time ago, a couple of decades ago. And although they're now, I think, a world leader in this area, I don't really remember getting any education at that time about spiritual care. I think what really struck me wasn't so much looking back on the lack of that in my medical school education, but just looking at my day-to-day activities. I am not that often the first one or one of the first ones to really sit down with a patient who has, say, a new diagnosis of pancreas cancer and explain to them what that means for them. And it's a lot for a patient to hear. And I think I probably missed a lot of patients who were just, barely keeping their head above water in spiritual distress. And the more I've paid attention to that, the more I've realized, how prevalent it is. And so I think it's really more my current practice that has raised my awareness about this. And indeed, I mean, religion, I think, is just fascinating to me. I mean, it's I feel like it's one of the forces that has shaped our world maybe more than any other force in the world. So it's And it's something that's so important to so many people, and so it's those are the sort of the things that have raised this and onto my radar screen. Any other questions? I see Antonina has joined us. Hi, Antonina.
I did. Sorry, I was off camera for most of it, just so I can, so I wasn't disturbing jumping in later. Thank you so much, Dr. Cunningham, for being here for this presentation. Just a question for you. I find two things. One, I hear often something you expressed, which is providers articulate a desire to know more about this, but simultaneously say that they really don't. They're not trained for it. So it's generally someone else who should be providing any type of spiritual attentiveness. Do you have a plan for how you would actually engage your physician or clinician colleagues to engage in something like a religious literacy course? Because I don't find that segue always the easiest. I think it might be easier coming from a peer colleague such as yourself, but I wonder if that's actually something you've fleshed out a little bit more.
Yeah, it's actually something we're talking a lot about now. And like any other thing in life that previously was not on your radar screen and comes on your radar screen, there's a variety of ways that those things get on anyone's radar screen. For me, like I just described, it was sort of personal experience, but we don't live in a vacuum, so it's reaching out to our colleagues. And I do think that you're probably right that sometimes we tend to maybe pay more attention to people who do what we do. And so that's sort of the approach that I'm taking here. I've been meeting with Trevor Bonnet, who is our local mission integration, our Chief Mission Integration Officer, and we have been discussing with a couple of their nurse managers about starting on just 1 or 2 floors, and just starting little by little. We after the GWISH course, we had our first. They really have great follow-up. We had our first follow-up call this past week after the course completed in November, and this was indeed one of the things that people asked when or that people mentioned when asked, what roadblocks are you running into? And it's how do you get the message across? How do you bring someone to see what you see? Because we all know you can't grab them by the scruff of the neck and pull them. I have a 3-month-old puppy now, and they don't learn. Nobody learns like that. Puppies don't. People don't. And so we're showing by example. We're talking in small groups, and we're making small incremental and therefore doable culture changes in little baby steps. I mean, one of my guiding principles in life is that big change happens in little tiny baby steps. We tell our kids that all the time. If you're a surgery, I tell the residents that too. If you're a surgery resident and you have a textbook you want to read, 365 days out of the year, you read a little tiny bit. Next thing you know, you've read the whole textbook. And so we're starting on 1 floor. I'm meeting with my surgery colleagues individually and presenting to our surgery business meeting. And then we are going to start with the nurse managers on just 1 or 2 floors and put up some signage, some reminders, have some in-services, and that's how we're taking it, just sort of 1 step at a time.
Thank you. I very much appreciate that. I'm also wondering, is there an opportunity as we're looking at all of the GME education within Ascension, and we have such a large GME program, so residency program within Ascension, if there's opportunity for you to connect with that group and look at that curriculum as well.
With the IPCE?
Yes, and with the group, yes, or have you been already? I don't know.
Yeah, and with GME, yes. So I've been, so we actually have put together a one version of sort of this talk that I gave today for the Ascensions IPCE, and I actually did not realize until I started talking to Suzanne Buchanan about this, what an amazing resource that is. There are so many opportunities for continuing education credits there for physicians, PAs, nurses, social workers, pharmacists. And so we're doing one there on religious literacy. In fact, it was actually live for a little bit and is being tweaked a little bit now. We'll probably go back up live again soon. So thank you for asking that. And from more GME, so I'm, another thing I want to do that I'm going to be doing here is just, giving this sort of a version of this talk to our residents and students and staff in a grand round setting.
We have a question in the chat from Christy Zahn,
Thank you.
who wrote, "Are your definitions of spirituality and spiritual distress inclusive of people/patients who identify as humanists or atheists?
Absolutely.
Can the humanist, not religious nor spiritual, still experience spiritual distress?"
Yes.
Chaplains,
Yeah, it's a great question, and I'm so glad that somebody asked that, because I think it's a common misconception that only religious people are spiritual. And one thing that I think I've increasingly realized over the last 5 or 10 years is that one part of the spirituality definition that I hovered on to emphasize it being intrinsic to our humanity is actually true. So we could even go back to that definition, but it's so the atheist has sort of become a little bit of a unfortunate word, because while there are many, I know a great many actually spiritual atheists, the term atheist, because of a few very vocal atheists, and I'm thinking of the 4 authors who've been referred to as the 4 horsemen, Daniel Dennett, Samuel Harris, Richard Dawkins, and who am I missing? Anyway, are atheists, but are more not just atheists, they're anti-religionists, and have the same sort of fundamental militant approach to, against religion that, some religious fundamentalists or extremists or terrorists have in favor of religion. And in fact, it's sort of ironic, because those are the authors that actually first brought me that I first encountered as I became interested in religion a couple of decades ago. But not talking about anti-religionists, but talking just about your sort of average everyday atheist or agnostic or humanist. They would be the ones that I was referring to in the end of the spirituality definition, where I said spirituality has voice in our beliefs, actions, practices, whether or not those be religious or otherwise. There was during the ISPEC course, one of the case studies, in fact, was just this sort of person who self-identifies as non-religious, and some people even don't self-identify as spiritual. And when I'm not thinking of the group that we hear about in like the Pew surveys that are described as, quote, spiritual, not religious, because that term spiritual, not religious sort of refers to a particular group that's surveyed sometimes. But the kind of spirituality I'm talking about is just a part of being human. I'm actually just going to go back to that. It's having meaning, purpose, dignity, hope, faith, community. These are the things that make up the spiritual part of being a human. And while, of course, there are pathological manifestations of being a human where someone may lack some of these things. A part of being a normal human is having these parts of your whole person. And the word that I'm giving to these parts are spiritual, and none of those words really have anything necessarily to do with religion. So I'm super glad that somebody asked that question. Who asked the question again? Anyway, it doesn't matter. Thank you for asking it.
She followed up by saying, I find asking the question, what is sacred to you? What helps fill you with awe or wonder? Helps me to connect with humanists.
She's saying that she finds that question one that helps her connect with people.
Yes.
Yeah, absolutely. Yeah. I mean, you know, you find out very quickly when you start asking people about their support system, or what gives their life meaning, or who they talk to. You know, if they go immediately to their church group, or they, start talking, then you know that this person may self-identify as religious. But very often the people who want to eschew the label of religious or even spiritual, when you give the conversation a moment to take root, it becomes clear that obviously they also have something that gives their life meaning, that or purpose. They have things that they hope for and things that they fear. They have a community, and those aspects of being human are what I'm referring to as spiritual.
I think we have time for one more question. Anybody has one? Not hearing any. I wanted to say a very big thank you, Dr. Cunningham, for coming and talking with us today.
My pleasure. Thank you. And thank you for that comment, Jenny and everybody. My contact information is on the slide. If anyone ever wants to reach out to me for further discussions or collaborations, please do so. I'm very easy to reach and happy to hear from you.
And we look forward to hearing more about how your pilot projects go and kind of how your outreach and advocacy for religious literacy continue to shape the field.
Thank you very much. Have a wonderful day, everybody.